everyone, Dr. Z here with one of my favorite patients, here to teach you about the warming sheet wrap treatment. This is one of my absolutely favorite home remedies for increasing the body's ability to heal during active infections. I've used the warming sheet wrap treatment to help people turn the corner when they've had really bad cases of the flu, and I've even seen cases of pneumonia turn around with this home remedy. So other things that this treatment can do is it promotes circulation in the body, it also moves lymph, it's a generally warming treatment, and aside from improving immune function, it also helps some people overall decrease their pain levels. The warming sheet wrap treatment can also be used to aid in detoxification, whether that's just doing a home cleansing program, or if you're trying to quit smoking and want to push some of those addictive metabolites out of your system and help you get free faster. The materials you will need to perform this treatment at home include, first and foremost, your patient. You will also need 2 warm blankets, ideally made from wool or fleece, as well as a top sheet, ideally made from cotton that is unbleached or undyed. You will also need a towel, along with a bowl of cold water and 1 to 2 washcloths. While your patient is resting, it's also nice to have pillows or a bolster to put under the head and under the knees, and to offer them sips of water through a glass of water with a straw. And to get the treatment started, you also need a warm place for the patient to first get warmed up, such as a hot tub, a warm bath, a shower, a steam room, or a sauna. Before getting started, make sure that your patient doesn't have any of the common contraindications to this treatment. Because this treatment can be so stimulating to the immune system, it may be contraindicated in people taking immunosuppressant drugs, such as people that have had an organ transplant. Because it is so circulatory promoting, furthermore, people with congestive heart failure might not be the best candidates for doing this treatment at home. People with diabetes can't always tell when a temperature is too warm to be causing damage to their skin. So if you're helping a friend or a patient with this treatment, always check the temperature on yourself before administering to your patient. And lastly, people that have unstable asthma that is triggered by cold temperatures might not be the best candidates for getting this treatment either, as there is a shock of cold that happens at some point during the treatment. As always, check with your healthcare provider before making any changes to your plan or trying any remedies at home. The patient or person being treated first needs to get warm. The easiest way to do this is to have them take a nice hot bath while you prepare the rest of the materials. Take your cotton top sheet and run it under cold water. Once the sheet is fully saturated, be sure to wring it out as best as you can so that the sheet is damp more than it is wet. Now this looks very easy here because I'm not actually using a full human-sized sheet. So when treating humans, this step is best done using 2 people to wring out the sheet. To make this sheet even colder, you can stick it in the fridge or in the freezer. Before the patient gets out of their warm bath or warm shower, prepare the bed. Put down the warm blanket or blankets that you'll be using to bundle them up. Make sure you have the rest of your materials nearby, and pull that wet sheet out of the refrigerator or freezer. Lay it down in such a way that it is long enough to cover the full length of the patient's body. Now we're ready to get the monkey out of the tub. Now it's time for the patient to get out of whatever warm place they've been in. It's important that you stay with them as they get out of the tub or shower, as they may be dizzy and need some support as they get out. Have them towel off as quickly as possible and then head over to the wet sheet station. First, have the patient raise both arms up as you bring 1 layer of the sheet over to get their trunk. The patient can then drop their arms by their sides as you bring the next layer over. And make sure that they're tucked in really tight. Next, warm them up with the dry blankets, being sure to really tuck them in around the neck so that no cold air can get in around the neck, as well as at the feet. Snug as a bug in a rug. Place a pillow or two under the patient's head and offer them a bolster under their knees if their back is hurting. This will be uncomfortable at first, but don't worry, it doesn't last forever. You can also take one of the washcloths, dip it in the ice-cold water, and place it on the patient's head to help them cool off. You can place another washcloth on the back of the neck if the patient would like. While the patient is resting, offer them sips of water through the straw throughout the treatment, and refresh the washcloth by dipping it into the cold water, wringing it out, and reapplying it as necessary. If the patient feels chilled at all during this treatment, you can make sure that they're tucked in around the neck and feet, provide them with more blankets, or provide them with a hot water bottle or electric heating pad that they can put under their feet or that you can put over the torso, provided that there's a waterproof cover on it. After 20 to 40 minutes, it will be time to wrap up the treatment. Again, you'll want to open up the blankets just a little bit and make sure that that sheet is starting to feel a little warm. It's not going to feel dry, but you don't want it to feel cold anymore. Then unbundle the patient. You want to make sure that they don't catch a chill, so once you loosen up all the sheets and blankets, have them first reach out their arms and then cover them back up. Take another washcloth, wring it out well, and with cold water on this washcloth, we're going to perform something called cold mitten friction. And as the word friction implies, we're not gently stroking, but we're actually scrubbing the skin with this ice cold water and this cloth. We'll start with the arms, then we'll redunk, and next we'll do the chest, and have the patient sit up and help them as they sit up, and cold mitten friction to the back. Help them lie back down, and bundle up their upper body as you work on the lower body. You do the belly and the legs. The patient will probably want to get out of that wet sheet as quickly as they can, so you can offer them a dry towel and help them sit up when they are ready. Get rid of that cold wet sheet and bundle them back up. At this point, the treatment is done and the patient can continue to drink water. They'll probably want to take a shower, but they should not jump up and get super busy and active. They'll likely want to rest after this treatment is completed, and you can let them do just that. I hope this treatment serves you and your loved ones well. I'm Dr. Erica Zelfand, and thank you so much for watching.